CPR is an important life-saving tactic used by millions. What some people don't know is that when giving CPR to a patient, it is a little more complicated than just pushing his or her chest. So today, I'm going to explain why and how CPR, or how and why CPR is necessary to learn. First and foremost, the information that I am giving you will not certify you in CPR. I will explain how you become certified later. CPR stands for cardiopulmonary resuscitation, or the return of spontaneous circulation. It is a life-saving procedure for a victim who has signs of cardiac arrest. This also can, or no normal breathing and no pulse. It is vital for an unresponsive victim to receive CPR as soon as possible to increase the chance of his or her survival. Cardiac arrest can happen anywhere, in a school, in the street, shopping mall, or even a controlled setting like a hospital. According to the American Heart Association, or the AHA, the system of care is different depending on whether the victim has an arrest inside or outside of the hospital. I will explain how to handle a cardiac arrest situation which happens outside of a hospital. To best describe cardiac arrest and how to deal with it in a situation, I came up with a little scenario. You're walking into a meeting with an academic advisor at 3 p.m. on a Tuesday afternoon. You come to find Mr. Johnson seated at his desk. He looks to be not feeling well. Mr. Johnson states that his chest hurts, he is sweaty, and short of breath. You also notice his skin is quite gray. All of a sudden, Mr. Johnson goes limp, falls out of his chair onto the floor, becoming unresponsive. What do you do? As a lay rescuer, or a student who is not certified in CPR, you are expected to recognize the victim's unresponsiveness and call for help, preferably 911. You would then initiate CPR and use an AED, or an automatic external defibrillator, if one is available in this facility. You continue CPR until EMS arrives and takes over. To initiate CPR, you first lean down to Mr. Johnson and feel for a pulse. You will find this approximately 2 finger widths from his Adam's apple on the side of his body you are seated. Next, you ask yourself, is he breathing? Is he breathing? Listen for simultaneous breaths and watch for a chest rise. If able, open Mr. Johnson's shirt and in 10 seconds, place your hands one on top of the other in the center of his chest at about nipple height. Compress at depths of at least 2 inches and at a rate of 100 to 120 per minute. It is imperative that you let the chest completely recoil after each compression to allow the heart to fully refill with blood. It is also very important to deliver compressions at a 90-degree angle to protect the victim's vital organs from being punctured if a rib happens to break. CPR is performed by a series of chest compressions as well as breathing for a victim who has no pulse or no spontaneous breaths. Although you as the performer are supposed to be breathing for the victim, you are not to breathe directly into his mouth. Instead, use a breathing barrier. This protects you from any bodily fluids that could put you and or Mr. Johnson in harm's way. A common way to time the compressions is by singing to yourself. The best song is to be singing Staying Alive. According to GEMS for EMS, no breathing is necessary if you do not have a barrier to protect yourself from bodily fluids. Gravity will pull oxygen into Mr. Johnson with each compression and circulate his system. Your job as a performer is to focus on effective compressions. Now, has help arrived yet? Did you assign someone to call 911? Is there an AED available in this facility? When help is available or when the 911 response team was activated, someone needs to continue compressions while another locates an AED. Once an AED is located, you put it on and to increase effectiveness in case of a cardiac arrest when CPR is in progress. AEDs are now found in most public buildings, schools, and almost all law enforcement vehicles. An AED has 2 patches called electrodes. The proper placement for these electrodes is on his chest. You then turn the machine on, and the AED will verbally tell you what to do. It is literally dummy-proofed. An AED will tell you when to stop CPR, when or if the victim is shockable, and when to resume CPR or check for a pulse. It is recommended by the AHA and the EMSRB, or the Emergency Service Regulated Board, to place an AED as early as possible on the victim to get the best chance of survival. Granite Falls ambulance staff Anita Rosno states that there are situations where CPR is not appropriate. These situations include traumatic injuries, non-sustainable life or decapitation, obvious death when the victim was found quite after some time, if the victim is stiff and there's a pool of blood around him, or if the victim states a DNR, or a do not resuscitate order. This is when the victim wishes to not have CPR performed if a cardiac arrest occurs. CPR is the #1 basic life support tactic used. It is very effective in saving the life of your victim due to a cardiac arrest issue. There are many ways to become CPR certified. First, you should contact your local hospital or ambulance service. They are able to certify you in a classroom setting with hands-on learning. If the classroom setting is uncomfortable for you, the AHA does offer online learning, but you are needed to perform CPR in a training facility on a mannequin. CPR is a great service to have. It is highly recommended to acquire the certification. That way, if someone goes into cardiac arrest in the middle of the street, you are prepared to help.
Yay!